This is our first CPD for the year, and today we are meeting with the Nutrition Caucus. We have in our midst Prof. Reginald Annan, who is the chair of the nutrition group. We are going to talk about how to move our nutrition group within the Ghana Academy of Nutrition and Dietetics forward. So let's welcome Prof. Annan as he takes us through our CPD or our meeting for today. Prof. Annan, over to you.
Okay, thank you very much, Senam. So I think that today's meeting is also more of an interaction. So I hope that all of us will try and interact during this meeting and then speak up to the issues and ask the necessary questions so that we will see how we will move forward as nutritionists within the Nutrition and Dietetics Academy that we have here in Ghana. And so as Patient and Senam said, the first thing we want to talk about is why nutrition caucus? Why nutrition caucus? So I probably will mention a few things, then also allow us to basically comment and also say what you are thinking about and so on and so forth. So I mean, when we say why nutrition caucus, it's almost like asking why is nutrition important. And we know that the academy is made up of nutritionists and dietitians. And currently, the Allied Health Council does not allow the registration of nutrition and nutritionists and dietitians together, like so RDN, which we are hoping that we'll get to a place where we can register people as nutritionists and dietitians together at the same time. This is because, I mean, I believe that that is the way the world is going. You know, to train nutritionists and also to train dietitians and to employ nutritionists and also employ dietitians, it costs a lot of money. So what that means is that you have to station nutritionists in different places and dietitians also in different places. But if you look at how the different cadres of nutrition can work, there's clinical dietetics, there's also community dietetics, there's community nutrition, and also public health nutrition. And you can have somebody who can operate within all that. So a trained dietitian who can work in the community is a community dietitian, but that person can work within overall nutrition promotion. So that becomes community nutrition. And so from clinical dietitian moving into the community as community dietitian and then community nutrition, because you're generally promoting nutrition in the community rather than just focusing on people with health conditions. And then when it becomes a bigger, larger population, it's public health nutrition. And so this is where we are going to, but at the moment we are not there yet because the council allows registration or licensing as nutritionists or licensing as dietitians. We also know that, for instance, here in KNUST, our training is nutrition and dietetics. So basically, it means that the person is already trained to be able to do both. But because the council doesn't allow the licensing, that's why you have to choose whether you want to go into the nutrition or you want to go be licensed as dietitian, even though you have the training to do both. So, but what am I saying is, so the reason why we need to have the different caucuses is because first of all, you cannot be both within the framework, the national framework we have now. But because of that, we can meet as each caucus and look at specific issues that we face, specific things that we can do to promote the caucus, and also move the fraternity, if you put it that way, in that direction. So that is why there is a need to have a nutrition dietetics and a nutrition for caucus and also a dietetics caucus. And as we are meeting, I'm sure the dietetics caucus will also meet, or they may have even met to talk about some of these things. We know that nutrition is very, very important. Nutritionists are needed in every sphere of life. We must have nutritionists trained and employed even within schools. Schools should have their nutritionists both at the basic level and at the second cycle level, at the tertiary level, and all that, where canteens and cafeterias and eateries are operated, food services operated. We need them. Then also we even need nutritionists by private enterprises that also even operate food service. Before you even move outside that into within the health sector, there are also nutrition to promote. In the district, in the communities, there's nutrition to promote. In the general population, there's nutrition to promote. Nutrition can be promoted from policy level, advocating for policies that promote nutrition, and as well as nutrition programs that need nutritionists to make sure that those programs work. And so definitely a nutrition focus is very, very important within the Ghanaian framework. And that's why we have Ghana Academy of Nutrition Dietetics. And that is why within that, even though we are all one body, we also have the nutrition focus and also the dietetics focus, and we are meeting. I know that in not long ago, we went through an activity where we were actually developing the different professional areas or specialization areas that nutritionists can practice, and if possible, can even be licensed in. Just like we have for, we did also for dietetics. So such as you can have a pediatric nutritionist. You can also have geriatric nutritionists. You can have sports nutritionists. And all of this should be within our national framework where you have the people trained to practice as nutritionists working in all these areas. And even though we are not there yet, I know that those professional areas, specialization areas are now being set up, and in due course we will get there. We'll reach a place where even the government can employ people to work in all these different areas and to promote nutrition in all those different areas. And so I must say that we have to start from somewhere. And so if you are in this meeting, don't say that, we don't have this, we don't have that. But maybe we must start now, hoping that even if we don't enjoy it, and I'm not saying we shouldn't enjoy it, but maybe in some years to come, we'll have all these things in place, and then we will see a country that is moving forward and has all the professionals in all the different areas, in all the different cadres, in all the different specializations working. And having said that, I must also say that the nutritionist must also be able to set up private practice and operate and then do it well. And because people are really looking for nutritionists now, they are asking, what should I eat? They are not people who are sick, people who are well, but they want to eat well to promote their health. And because health is not merely the absence of disease. And health is not just preventing disease, not even treating, let alone, it's not treating only. And it's not only even preventing, but promoting positive health, which is a quality of life. And so you don't have to be sick or want to even prevent a disease before you need a nutritionist. You need a nutritionist everywhere. And people are asking now. And so we don't even have to necessarily wait to be employed by somebody, by a private hospital, a private organization, or a school, or even a government. we can set up private practices and let it work. Recently, a pharmacist was talking to me and he said he's surprised that the way pharmacists, when they are trained, they know that they must go out there, they can set their pharmacy up. And it is a very common thing. And it is ingrained in their training that they must go, as they are going out, they must set up their pharmacy and work there and make it there. And he was surprised that nutritionists don't think like that, that he feels that when he's working in the community, he must see such private practice commonly, just like you see a pharmacy that you can go and then buy. And he's a pharmacist telling me this. It's actually one of the lecturers. And so, I mean, it's for me, it's an eye opener, because we know that all our nutritionists and even the dietitians all think that they must be employed and work with the government in a hospital or in the community, but you can actually even set up a private practice. And if it may not look very lucrative now because people are not used to it, but then we have to start from somewhere and then get it reach where it can reach. So I think that, and this is why having this caucus is very important. And this is why, as we have started this meeting, we'll do them regularly to talk about these things and then to see the way forward and get people moving and not, crippled in one place and paralyzed in our steps and thinking that we cannot move forward. So this is what I want to say in summary regarding our first agenda, why nutrition or dietetics caucus. We need this group to work within the GAND and to talk about issues specific to the group and also to see how we can move forward. And moving forward, is very diverse. We must be open-minded and see all the opportunities that are out there. So having said that, I will also want to see if anybody has put any comments. Please, you may want to even just raise your hand and say something. You can interrupt me and say, but you can also put something in the chat box so that, and listen, this is the CPD point for meeting, because what we are talking about is very important. It's not only when we come back talk about the benefits of the facts about SSB, like pure science, that makes it important. This is also important for the profession. So it is a CPD point scoring meeting. And so as I'm saying, if you have any comments, you can put in the chat box, but also you can actually also raise your hand or even interrupt me and then comment. So I will keep quiet and allow comments. Then we can take the next agenda, which is how do we populate our caucuses? So specifically for our caucus, how do we populate our caucus? So any comments on what I've said so far before we come to how do we populate our caucuses? And then that one we would, okay, any comment first, please. So if you have any comment, please let us know. You can also chat. You can also put them in the chat. Manyaya, please.
Hello, sir. Good evening.
Good evening, Nana. Sorry, who is speaking?
Manyaya.
Manyaya, please go ahead.
Thank you, sir, for your submission. I have a question to ask. I'm excited about the going private you mentioned, but there was an incident I actually witnessed, and I want to say it here and see how we can handle that as individuals. So I have a colleague that started practicing privately, and on his flyer, he stated some of the services he renders at his center. So I shared it on my status for him, only for a dietitian to come into my DM and told me that the person is not qualified to run some of the services he mentioned that he does. And some of them were specific disease management. So I was trying to say if he can do it, why would he not be allowed to do it rather than going to school to first of all become a dietitian before he can do some specific things? So I don't know, are we having specific roles aside handling medical conditions, or how do we handle such things when they come up? Thank you, sir.
Hello, Prof.
Sorry, I was muted. Sorry, Manyaya. So I was answering your question, and sorry that I was muted. When I finish, I'll read two of the comments that are here. Oh, sorry. I didn't realize that, and I've said a lot. So I was saying that to answer your question, and I'm sure that some of these things will go back to the board, the GAND governing board, for more discussions. But to answer your question about some of the nutritionists were practice and claiming to provide services in disease management, and I'm saying that I am a trained nutritionist. Part of my training also include we even do a course for clinical nutrition. We also do look at even the causes like diet and disease. So I understand the relationship between diet and disease. I know the impact of disease on the nutritional implications on various diet-related diseases. I also know the impact that nutrition will have on particular diseases. And I know the changes in the nutritional requirements and therefore guidance that can be given or recommendations when somebody has a particular disease. So let's say somebody has hypertension. Nobody can say that as a nutritionist, I cannot provide guidance or counseling to the person on, first of all, because he has it already, so I can't do primary prevention, but I can do secondary prevention for the person. I can even do tertiary prevention, because if somebody has a condition, they're already progressing, we don't want complications, so we can do secondary prevention by giving counseling and guidance to the person on how they must watch their nutrition and how they must manage their diet. And there's nothing wrong with that. So if you have cases like that, you can also come to us as a body, we will address them. And as I was saying that, my colleague sitting here said that even pharmacists give nutrition guidance sometimes, general recommendations to people, because they also train, they do some nutrition, and they can tell people that, look, if you have hypertension, reduce your salt intake. I don't think a dietitian should, and this is why we are having these meetings. A dietitian should tell you that you cannot tell somebody that reduce your salt intake to manage your hypertension. Even that somebody on the road that can tell you that. So this is what I think. But we will, some of these things we will also address them at a higher level. And as I was saying, I even was saying that just last 2 weeks, my friend, who is a specialist surgeon, a breast surgeon, because breast surgeon, they also do a lot of talk, they also do a lot of courses in nutrition. So he understands a lot of things. And he was telling somebody on some, giving them nutrition, I would say guidance. He wasn't calculating any diet for the person, but he was giving the person some counseling to prevent something, which would have some surgical, because of the discussion, I may have surgical indications and all that. So I don't think that the person is wrong. So, and to say that they can provide nutritional guidance because they are nutritionists. So they can provide nutritional guidance to people with nutrition-related diseases. That's what I think. But I will also discuss it further, and then, but I'm saying that if you have issues like that, it's good. That's why we have the association. You come to the association, and then these things can be resolved. And again, I don't think an individual dietitian should tell another person if the person has an issue. That's what the company is there. That person who has an issue with that person can also come and say it formally. Then we'll look at it into it formally and then provide the necessary guidance. So that's what I will say for now. So let me read some of the comments that I have here. Somebody said, David Tekbo, he said, I like the idea of nutrition professionals setting up nutrition shops, just like pharmacists. Worth considering. I'm glad that somebody sees it today and then it becomes an eye-opener, because like I'm saying, a pharmacist told me this. He wonders why, when he works in the communities, he doesn't see nutrition shops. Yeah. So even nutrition shop, and then your nutritionist should manage the shop. So that when they come, you're not just selling them the product, but you are giving them nutrition counseling, guidance on the products. Because if you just put the sales girls in the nutrition shop, the person comes to pick something. This morning, somebody was showing me what seed was it? Pumpkin seed. It's healthy, but it's healthy how? So that's why if you have a shop like that, the nutritionist should manage it. And therefore, if somebody has such a shop, you can contact the person. They may want you. They don't know who can help them, but they may want you to come and step in sometimes, a few times for some locum, and give guidance on these things. Of course, that means your training or as a nutritionist must be deep, because some people, you won't be able to talk about these things. So that also will be a problem. But I don't think that, I think it's a good thing, and people should want to go into that. Let me finish reading a few more before Canada, Ghana Nutrition ask a question, his question or her question. Okay, then somebody says, starting as a private practice is a good idea. Question is whether a special license may be needed. Well, if you are setting up a business, there are license requirements for setting up businesses. You have to register and things, so you might go into that. If you are setting up a business that has to do with food and drugs, then also there are implications for that with FDA that you might go into. That's different. But then also the license you need to practice as a nutritionist, if you have it, then it allows you, even without a shop, to be able to practice as a nutritionist. So please, if you are setting up a shop, you might go into, or a practice, which is a business, you might go into all these other aspects of registering, and then if there are products, the products might be licensed, and so you must go through FDA. So please, let's take that into consideration. Jonas Mark says, thank you, Prof, for your submission. Please, I'd like to know what the Academy has done so far to make reality the use of credential RDN in Ghana. As you rightly put it, that is the way the world is moving, and we must not be left out. Has there been any engagement with the right people yet? Thank you. Yes, we have started talks on RDN, but like I said, Those that the world that you see that have also gone so far, they started so far, so long ago. You know, somebody was telling me the last time they had, I was looking at let me somebody tell me, I read it. The first time they were having a nutritionist meeting in the UK was 75 years ago, that the official nutritionist meeting. 75 years ago, that's when now they have like a nutrition association and wanting a nutritionist meeting 75 years ago. So you can imagine how far people have come to be where they are at. But we are on the road to getting there, where there will be a time when you can have RDN. But as we are not there yet, your RN allows you to practice as a nutritionist. And we know the competencies of a nutritionist. So those competencies you are allowed to practice in that regard. Okay, Canada, Ghana nutrition. Please, the floor is yours.
Hello, good afternoon. Thank you very much for your presentation so far. I'm enjoying it. I have a couple of questions. My first question is to do with the designation. Now, you had indicated that currently there is RD and then there's nutritionist. But for some of us who were trained outside, where our designation is RDN, we are registered dietitians and nutritionists. When we come into this sphere of your required bodies, we are downgraded, not because we don't have the required, but because we don't fit the mold. What is your take on that? Because I'm a trained clinical dietitian and a nutritionist. I have the certification for both. But here I am forced to have to downgrade or choose one, which I don't think is correct. So sometimes I find that this part of the world is trying to catch up. And how is this being dealt with for those who have that already? That's my first question. So I'll allow you to answer that, and then I'll ask my second question.
Yeah. So I mean, as you are asking this, it tells me that it's a major problem, which we have to tackle it. We're already tackling it, but we must be much more not aggressive, but much more hasty in trying to tackle this. And so you are right. We will take, and from this meeting, our next governing board meeting, I'll bring it up strongly that we need to tackle this. Hitherto, I had only thought about those trained here in Ghana, and the fact that like KNUS, we train human nutrition and dietetics. So basically, they are already trained as nutritionists and dietitians, but currently they are only allowed to register as either of them. And so it's a problem. And the fact that you are saying it from even the perspective of those that are already trained outside and then coming in and being licensed, and what happens? Please, thank you that you asked it. You've asked it, and then we'll take that question with them, that issue very, very seriously. And then when we have our next meeting, definitely we'll come with some answers on the way forward. Please, thank you. So you can ask the second.
Thank you very much for your information. My second question is to do with the concept of having a nutrition shop or a health food shop. I believe that as of now, and sorry, it's not really a question, it's more of a insight, maybe that would help. When I started this 7 years ago, the only, and it's still the only requirement, is that I need to be registered with AMA. I'm already registered with the Allied Health Council to be a registered dietitian. My products and vendors have to be FDA approved, but there is no, aside from that, there is no licensing body, because other dietitians and other nutritionists have contacted me asking the question, is there something else that one must have, or something that one must acquire, or some special license to operate? And as far as I know, there is none. Aside from registering with AMA, as a business, or registering your business first of all, and then registering with AMA to operate within their vicinity or their area, and then having your products have FDA. Unless I am wrong, when I checked with, and please forgive me, the acronym, I can't remember, but the governing body for, let's say, clinics or hospitals, dietetic or nutrition center was not and is not there up to now. So I am of the view that dietetics should not be only practiced within the clinical setting, and that if you're trained to either be a nutritionist or a dietitian, our first call of I guess our profession is prevention. That's how I see it. So I also
maybe
am of the
Hefra.
mind-
Hefra, you mean?
Hefra, thank you, Brad Pence. Yes, Hefra. At that time, and as far as I know, maybe I'm wrong, somebody can correct me this year, I haven't checked, but Hefra does not have any does not have any stipulations for a nutrition or a health food shop. Because I did investigate, because I mean, having started this was sort of like, what do I need to know? There is no guidelines. You have to basically try it out, ask questions, and then go for it. I even had a physician who came to see me, who also went and investigated to see if there was a niche or there is a criteria that I would fit in. And he came back with the same response, which was that there was none. So I don't know if maybe there's something that we are missing, but I'm of the view that having a dietitian or having a nutritionist operate a health food shop or a health shop or a nutrition center should be part of dietetics. In fact, overseas in Canada and in US, it is. We have dietitians who run cafeterias within the clinic and outside of it. We have dietitians who set up private practice. So for me, it was not anything new. It wasn't anything. But I feel like here, you know, people are hesitant. People are afraid to step out and try. Even in social media, as a dietitian, you have a right to practice on social media, because telephonics, Zoom is a form of communication where you're able to see a patient. Because during COVID, that was how we operated. We would telephone a patient, talk with them over the phone. We've been doing that for years. So I feel like the profession, we limit our scope to some extent because we haven't charted it. Because as long as you have your knowledge and you have your license, I am of the view that you can practice anywhere. So please shed a little bit of light. If I'm wrong, please, I stand to be corrected, please. Please, you're on mute. You're on mute, please.
I'm unmuting myself. Thank you. I would please, can you mention your name so I can use your name rather than Canada, Ghana?
Sorry, my name is Mavis Asamoah PJ.
Sorry, the first name again.
Mavis.
Mavis. So thank you so much. You see, and truly you are raising issues that you always find to affect countries that are developing. So this is our problem. Basically, developing countries are behind in so many things. And so you are hitting the nail on the head. And what you also find in developing countries also is that the structures are not there for so many things, and the systems are not there for so many things. And so I like how you're ending it, that so for now, we shouldn't limit ourselves by saying that by you know, trying to just do things within a certain small framework. And if you're doing a shop and it has to do with food and drugs, because once food comes in, then there are issues with FDA and all that. But even if you go to talk with the FDA, they'll tell you their mandate is so limited at the moment. They don't have any mandate on labeling and then nutrient profiling and all that. So all they have to do is to see that what you say the food contains, what the product contains, what is contained, and then they license you. All these issues are a lot of problems that as young country per se in that regard faces. And that is why the association is there, the academy is there, we have to rise up and then make sure that the systems and structures come into place. We already also know that even as an GAND association, we don't have our own parliamentary approval, so we are operating with as part of the Allied Health Council. What also that makes us is very limited, because then we cannot, there's so many issues that nutrition and dietetics as a profession has, that we must address them individually, and which we cannot by when we operate within a council that has so many other professions under that have different, directions compared to us. And so it's good that these things are coming up, and I'm telling you, we'll take them head on and then help address them. But also, as we are hearing, it is for us to hear those on this platform that don't limit yourself and think that I can only do work within the government, or a locum in the private hospital, or employed in the private hospital if I'm a dietitian or a nutritionist. But I know that some of the hospitals also employ nutritionists and even employ dietitians. But all of us wait for that. But like as we are hearing, you can operate as your shop, you can even operate a surgery. As in, surgery doesn't mean you are doing surgery, but like in the UK, we call them surgery, where you see your general practitioner and then he counsels you. He doesn't give you drugs, he doesn't even write drugs for you, but he counsels you. And basically, a nutritionist can have that and counsel people, a dietitian can have that and counsel people. And we hope that soon it will be RDN, so that most of the people who are trained as dietitians, they are also nutritionists before they are licensed as dietitians. But because you can't do both currently, somebody must be here or must be there. And it's duplication and really waste of limited resources that the country doesn't have already. So we will also get to the place where the RDN will come in. Until it comes in, let's make the very best use of what we can do with the training and the knowledge that we have. And like I said, many people out there are looking for nutritionists and dietitians to advise them. They just want to know, what should I eat so that I'll stay healthy? And so you can have it doesn't have to be even in the shop. You can have your practice in the in the suitcase or briefcase and move around. Telephonists using social media, and as we are learning today, the sky is the limit to what we all can do. And those of you who are coming in new, some of us are involved in other areas. Our focus has not been working with individuals, but rather, maybe I would say mine is more like international nutrition. That's what I do. And so many must also go into the community level, whether you're a dietitian or a nutritionist or not, you can work in the community level and then set up your own practice and do it well within the framework that we have in the country at the moment. Do it very well, and then let's change promote health in the country. So I think that if you have any comments, you can put in the chat, and then we'll mention them. We have just a few more things to just talk about. How do we populate our caucus? For me, I think that that's the key thing. You see, the strength that we need as GAND to not make demand. It's not just that we are not fighting anybody, but to be heard, you must be strong. And the strength comes in the membership. It comes in the numbers. So I can tell you there's two groups that are very strong, but three that are very strong in the country. The Ghana Medical and Dental Council, very strong. Then the Nurses and Midwife Council, Midwifery Council, also very strong. And then the Pharmacist, and then the Pharmacist Council. Let me add the fourth one being the lab technologists that are in recent times coming out strongly. And it's the numbers, because they are trained and they are part of their councils or their associations. So I think that we must endeavor to all be part of GAND. Nutritionists, dietitians, we must all be part of GAND. and so that we have the numbers that will cause the policymaker to listen to us and then when we make demands or we go for dialogue, we are in a better position to be successful. So I want to say that. And so if you are in this meeting, you definitely know your many classmates who you were trained with who are not part of the association. So go and then bring them on. People make funny statements when you talk to them about joining the association. What do I gain? And I've finished and I'm not employed. Because you are waiting for somebody to employ you. I wish I was starting now as a nutritionist. I would do a farmer, a nutritionist, a nutritionist farmer. And I'm interested in, nutrition sensitive agriculture. It's a nutritionist who will do that. And you'll be surprised. When I bring my egg, I'll tell you there's a nutritionist producing their egg. And I will make a lot of noise and then I will get what I need to get. There's so many things we can do, but we think that somebody must employ us. So when we ask them to join the association and they make these funny comments that I don't get anything, I'm not even employed. But that's not the case. That's not what we should be doing. We must get the numbers so that we can also be heard. And so please send the message across to your mates, to all the people you need, who are also trained but don't belong to the association yet, so that we will populate the caucus. But when we populate the caucus, then we will also have our needs met. Currently, we want, even if we want all district hospitals to have nutritionists and dietitians. Are we there yet? No. I mean, recently I was talking to some people that even chip zones are not programmed to have a nutritionist or a dietitian, because we think that at that level it's not necessary. But it's very, very important, because if you are doing primary prevention, where do we start from? These are places where they serve communities where we need to prevent things. But and can you imagine if government decides that they will have a nutritionist or a dietitian in all the children? All of us will be employed and more. So I'm saying this to say that, look, let's get people on board so that we can go in and make such discussions with our policymakers, and so that they will hear us. And when we are also big as a group, then also when you set up your own practice and you call somebody and you tell them that I belong to the GAND, they know what GAND is. And that would also favor you in how you are practicing. So that's what I would say about how do we populate our caucuses. And we have a website. The forms are there on how to fill. So when you talk to them, you can send them the link to the forms. Then they can fill and be part of the academy. That takes us to how do we build a world-class dietetics or nutrition fraternity. That one, I would say that it is by international affiliations. It is by international affiliations. Some of us, some are trained already outside. So you have that affiliation. Please don't leave it behind when you are coming back. That network that you have because of the opportunity to have been trained outside is needed for your career, for your international affiliation. So keep it strongly. But I also think that even if you were not trained outside and you are a professional in the country, you must look for international affiliations. And I think that we must actively, it doesn't matter whether you are practicing in a hospital or you are an academic like me, we must also look for international collaborations through research grants. We can all do research. So I think that international affiliations, it comes by actively looking for such networks, using such networks that you have already through training, and also going to look for collaborative grants to write on, to bring research into the country, and then give us that world-class fraternity that we want to have. And then the fourth thing about also having that world-class fraternity is for us to try and attend the conferences. So there are dietetics conferences, there are nutrition conferences, that have held across the world. Let's try and go for some of them. So in last December, we attended the IC and the International Congress of Nutrition. It was the 23rd Congress. And I mean, I would say Ghanaians were there, well represented, but we can be more. We can be much, 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 much more. And I would also say that it looked as if it was only those in academics that were there. And so, and even those in academics, it was limited to a couple of institutions in Ghana. I don't want to mention this, but you know your institution, you know how not actively you are when it comes to going for these international conferences, because that's where you meet people and then you form your collaboration. So I want to say strongly that let us push also for this international affiliation so that we will be a world-class caucus, a world-class nutrition professionals, or overall a world-class nutrition and dietetics fraternity, that people know that Ghana is one of the places where if you want as nutrition and dietetics, you should go. And so that's what I would say. If anybody also want to make any comment on how to become a world-class fraternity, I would like to read that. Okay, so I'm seeing a few more comments coming up. Hamid says, please, we like for attendance, with the link for attendance again. I don't know what the link is. It like the link for the meeting? You mean the link for registration or link for attendance? Because
attendance meeting, like for those who've attended, the link is being put in the chat for them to fill in their details.
Okay, so please put somebody says you put the link again. Ahmed says, please, the link for attendance again. So I don't know whether they Ahmed missed that link. So please, if you can put it up again. Then Amatu Osman says, thank you, Prof. You have always maintained that we should look beyond the government. Very inspiring and forward-looking. I think so. I stand by that still strongly. Let's look beyond the government. The sky. I tell you, the guy asking me just 2 weeks ago, he doesn't understand why he walks through the community and can't see nutrition shops or nutrition surgeries or nutrition setups, just like we have the pharmacy ones across, because he really feels that people need it. And so I told him that I would tell my people. I'm telling you now. All right, so Cynthia says the brand endorsement in the clinical practice is known to be a no-go area in our practice, but I know outside it is allowed. What's GAND's take on it, please? Brand endorsement. Brand endorsement. Well, the little I can say is that we have to be careful because of there are two words and there's two phrases I want to use: conflict of interest and competing interests. And so when you are trying to go into that, you might be careful about competing interests and conflict of interest. And both of them can create problems for you, especially if in the conflicting interest scenario, you become soft towards the brand. I'm using soft figuratively towards the brand that you are endorsing. So you have to know that can happen to you. You may think that's what I don't want to quote a scripture, but I know somewhere you can say a man make a room for him. So when somebody gives you a gift, it can make a room for that person. Even if you think that you whatever by the Ghana Dental Association. That one is even different. That endorsement level, that one, I know that the FDA says they don't want brands endorsed by the association, but I thought this one, the person is being referring to individual. So it's somebody that has his own practice, clinical practice, and endorsing a particular brand. And I'm saying that that one creates conflict of interest and competing interests. But the brand endorsement, when it comes to the GAND, FDA says we should hold on for now because they are putting some structures in place. So we are also actually in talks with them because we were already endorsing some brands that they asked us to stop, which we have stopped. But it's still under discussion. But that's what I'm saying, that the two things that can happen when you are doing that, which you might be careful about, is conflict of interest and competing interests, because you can easily be swayed because the person you are receiving something from the person or from the organization. XTD says, let's also see how we can lobby the ministry to add specialist nutritionists in professional ladder of the profession. Yes, I already said earlier on that I think somewhere last year they were requesting for the different special areas we can have for nutritionists, and we have provided all that. And so just like we have perioperative nursing, pediatric nursing, and so on and so forth, they were looking for that. We've provided that. We will follow up to make sure that that information is being used. Somebody also say, please, if you are in the process of registering with AHPC or not yet registered with AHPC, but a trained nutritionist, how do you access the GAND website? That's what the website is available. And then remember that there are two things. The registration with GAND makes you a registered, and if you are a trained nutritionist, then you become a registered nutritionist. Then our licensing body is AHPC. So when you actually become licensed, then you have that's AHPC. So actually, if you're already trained and you are with GAND, you actually RN even when you are not licensed. The license makes you LN, but for namesake, everybody uses RO, registered. But the association is where you register with, and then the AHPC is where you license with. Just for clarity, but for now, we all use RD or RN, so let's keep it like that. Then let's also see how we can lobby the ministry. I've said that, I've already spoken about that. Please, the 2 CPD category A point is small for 50 GAN. That means we are going to pay 250 before we get the 10 CPD points for category A alone. Hamidu Akudugu. Yes, please, well noted. I'll go and talk to the bosses. Assuming next time the same point with the same amount until we get a 10 points. Okay, so well noted. And I'm sure some of the bosses are hearing are here and hearing in the background, even though they've kept quiet, they are listening. So they will come back to us on that. They will make it maybe cheaper.
Prof, please, can I come in on this one?
Yes, come in.
Okay, so with the CPD points for this year, we circulated information about subscribing for like the whole year at 200 cedis. If you're unable to pay that before a certain deadline, then it means you pay the 50 cedis per CPD. Asofo Beidou is going to take us through this, hopefully on Wednesday. He's going to have a CPD specifically to talk to the academy about everything related to CPD, the rates, the amounts, the attendance, sending lists to AHPC, renewing our pins, everything. So join us on Wednesday and then you get information on all that. Thank you.
Okay, so I hope that was clear from the explanation. Ernestina says, in the office now and forgot of my PIN. Can I get access to the form later to complete it? Sana, please.
Yes, please. She can contact me later and then I'll help her out.
Nice one, nice one. Thank you very much. Okay, so we're coming to an end soon. Okay, overview of GAND, aims and objectives and sources of funds. I want to open that up to one of the GAND governing boards who are on the call. So please, Senam, would you want to talk about that? Percy, our vice president, is also on the call. Percy is here, Prince Bedu is here. I see Nana is also here. And Senam is also here. Please, which of you would like to tell us about the GAND and of the aims and objectives?
Since Percy is around, it would be good if we hear from him.
Yeah, Percy. Percy.
Yes, Prof.
Great. Yeah, you are there.
Yes, good afternoon or good evening. I thought that
Not necessarily to read the aims, but just to, summarize the aims and objectives of GAND. That's all.
Okay, so I'm grateful for the opportunity. I want to just say briefly that all that you have said, in the past hour or a little over an hour, is part of the aims of GAND. But then the overarching aim for GAND is to bring nutritionists and dietitians together in the hope that together we can gather the numbers, gather the expertise to self-regulate our practice. And that is what this is all about, self-regulation.
Yeah.
Now, any profession that fails to self-regulate would always have will always leave room for other persons to infiltrate into its ranks and then do whatever they want and benefit from it at our own expense.
Absolutely.
So that is why the first step, I think I listened to Mavis and her concerns, and I just want to add to the answers you shared. We are working within a regulatory ambit which limits us, unfortunately. And that limitation actually is because even between ourselves, because I'm now talking between nutritionists and dietitians, we have not managed to find a synergy as yet. And that is why GAND became relevant. GAND is important to create that synergy that will help us to do three things. Number one, it will help us to streamline training and streamline the competencies of our profession. So I heard the conversations. Yes, Prof, you are right. Our nutritionists are able to do so much. Dietitians are also trained to do so much. But if you look at it critically, Ghana has essentially made nutritionists preventive practitioners and made dietitians, as it were, clinical or curative practitioners. But the training, the fundamental training is similar, if not the same. But then if we are able to work this GAND agenda very well, and that's what GAND is seeking to do, we look forward to streamlining the training so much so that the RDN credential will be very effective. So I can decide after my RDN accreditation to choose which aspect of nutrition and dietetics I am more comfortable to operate in. And that is what GAND is helping us to do. And the other final thing I will just add is that beyond all of this, GAND is not just an association. I think that sometimes it gets lost on us. GAND is not an association. GAND is a registered professional body by the laws of Ghana. Now that gives us the powers of a high court, basically. So GAND can actually, especially through its disciplinary committee, that's where self-regulation comes in. And also sanctions. So the example about somebody having issues with somebody else's advertisement, if that was reported to GAND, GAND had the power by the laws to determine what stands and then provide corrective measures. And that is what GAND is about. And by the law, I am just looking for the law. If I can share my screen briefly. Oh yes, I can. Let me just read the law out so that it doesn't sound like something we are saying from our brains. So 1 minute. So this is the Professional Bodies Registration Act, 1973, NRCD 143. I will say it again. The Professional Bodies Registration Act, 1973, NRCD 143. Now, this act basically says that anybody who practices a profession in Ghana must first, it's compulsory, be registered with a recognized professional body. That is the law. In other words, it is not as if we have a choice as to whether to join GAND or not. It is rather a requirement by law for each professional to be a member of the professional body. And that's the same way for law. You cannot be a lawyer in Ghana if you are not called to the Ghana bar. So people tend to quickly forget that GAND is that kind of organization where we are a creation of the law, because that's what we are registered to be. So we are all mandated by law to be members or to be registered by the professional body. And if we had this before 2013, perhaps we may have had our own council. And one of the aims of GAND is to get to that point where we can become our own council, and then we can determine for ourselves the many things that we have raised in this call. Now, let me add my final point. So for example, the pharmacists are able to regulate and say that if you're a pharmacist and you have a license, you can open a pharmacy shop. If you are not a pharmacist with a particular grade of license, you can only open an over-the-counter medical shop or store. Now, these are internal arrangements made within the professional space. And that is what GAND has the power to do. So most of the discussions that have come up, we have taken them on. I want to just say that we've had some discussions prior to this on those lines. We will firm them up with the feedback we have gotten. And then we can now be able to provide guidance and which will help our members with the surety that the professional body grants them the power. So you derive your power to do the things you do. In the absence of a law, you derive your power from a body. So that when you are taken on by anybody else, you have somebody who can provide legal backing for you. And that's what GAND also continues or seeks to provide. Thank you very much, Prof.
Thank you so much. Thank you so much, Percy. After such extensive explanation and on the aims and objectives, and then touching on some of the few things we have said already, I don't have to talk about them again. So our last comment, our last item on the agenda is any other business. As it's late afternoon, some may be closing to go home and all that. We don't want to take all your time. So we just go into the any other business and then end today's session and promise you that we will do this very frequently, if not even as a CPD, because this is very important, bringing out issues to help us address and then become a strong academy. We will do them much more frequently. So, and I'm sure sometime we can bring two the groups together, not just to talk about nutrition or dietetics, but talk about nutrition and dietetics together in the country and ask questions and address them. So this will be many more. There'll be many more of this to follow. So before we end, does anybody have any other business that they want to talk about? You can also put them in the chat if you want, and we will read them out and comment on them. Okay. Silence. I can't see any hands raised, and I can't also see anybody unmuting to say anything. So I assume that there are no other businesses. I would ask Senam to not summarize, but to do the needful and close the meeting. Thank you.
All right, thank you very much, Prof. Anand, for your submission. So Nana just posted in the chat that we should look out for COND. Yes. So the Conference of Nutrition and Dietetics will be happening this year. So announcements or flyers will be coming out soon. So let's please look out for COND. Yes. And secondly, I would like us to also note that we have another CPD this Wednesday, same time, 4 p.m. to 6 p.m. Our speaker is Pastor Prince Beidu. He is the chair for the Practice Standards and Accreditation Committee. He's going to talk to us about sharpening our profession.
We've lost Senam.
Yeah. Hello.
It looks like we have lost Senam. So I think she was saying that there's another CPD this Wednesday, and that would be facilitated by Prince Baby, who is going to talk to us about sharpening the profession. Okay, Sanam, you're back.
Yeah, I'm back. Sorry. So if you've not paid your 200 CDs as subscription for the 2023 CPDs, please let's do well to pay and join this program. And for those of us who have paid, we should send a screenshot of payments to the GAND Treasury line. The number is 055-802-4674. We can make payments to either the GAND mobile number or to the Ghana Academy of Nutrition and Dietetics GCB account number. When you reach out to the secretariat or to any of the executives or the governing board, all this information regarding the payment details can be made known to you. Okay, I see a hand up. Yes, XTIGI.
Hello, can you hear me?
Yes.
Please, payment for the CPD. If let's say somebody haven't paid now, but will pay before the deadline, can the person claim today's CPD as well?
Also for Bedu, they can, right?
Yes, they can.
Okay, yes.
Okay, thank you.
You're welcome. So please, if you've not filled out your details in the attendance form, kindly do so, because this is the list that goes out to AHPC to be uploaded onto our portals. And then at the end of the year, we use that for PIN renewal. And please, let's also make it a point to be attending the CPDs. We shouldn't say we've paid the subscription, so we are entitled to have our names on any attendance form that is shared. You have to attend to qualify to have your name on the form, because we look out for those who are here and we compare to see those who filled out the forms, so that we don't have different, or you don't have names that didn't attend getting CPD points when they did not. So all this and more will be shared with you on Wednesday. So if we don't have any other questions, I think we can call or adjourn our meeting till next time.
All right then. So thank you so much, everyone. for coming. The meeting is duly adjourned. We'll see you Wednesday for the next CPD.
Thank you.
Just a quick one. Just a
Yes.
very quick one. I just put the law I was quoting in the chat for those who care to read it for themselves. Thank you.
Okay.
Okay, we can see. Thank you all. Enjoy the rest of the day. Bye-bye, everyone.
Bye. Okay.